Hello, everyone, and thank you for joining us. My name is Eric Wagner, and I'm a staff correspondent and government executive. It is my great pleasure to welcome you to today's webcast, Demystifying Federal Health Care Coverage, underwritten by the Federal Long-Term Care Insurance Program and FedPoint. Today, we'll discuss how the COVID-19 pandemic has made the difficult challenge of choosing the right health benefits an even harder task. With so much uncertainty around work and family life now, predicting your healthcare needs for the coming year is more fraught than ever. Every year, open season gives federal employees an opportunity to reevaluate their needs. In this digital event, we will explore the ins and outs of the Federal Employee Health Benefit Program with experts during this critical time. But before we get started, I'd like to go over a few housekeeping items. At the bottom of the platform, you'll see several icons, including the Q&A tab, which allows you to ask a question. We'll be fielding those toward the end of the program, but feel free to submit questions at any point along the way. If you experience any technical difficulties, please contact us by chatting with the host listed in the platform chat function. Joining us today are Scott McHenry, Associate Director of Benefits and Services Team at the Internal Revenue Service, Walt Francis, author and consultant at Consumers Checkbook, and Maggie Martell, Senior Policy Analyst at the Office of Personnel Management. Thank you for joining us. Well, I guess, just to start, I think a good thing to go over as we prepare for the FEHBP open season is sort of what kind of different factors should federal employees be considering as they weigh the various options available to them?
Either could get better or worse, and on and on. What other plans are there? And the answer is lots. And which ones might be a better deal? That's a starting menu. I think the crucial thing is the problem is people don't like to pay for health insurance or think about health insurance. It's much less interesting than a football game for a Sunday afternoon. So what you do need is a little bit of discipline to look at the checkbook website or the OPM website to download the brochure, which will always be a PDF file of the plan you're in. Look at the brochure. There's a section called How the Plan Changes. It'll say for 2021. You want to read that section to see what's going on. It may be there's a benefit that really matters to you that's added or going away. Either way, you need to know. This year, there's a big effect because of the COVID virus. And there have been a lot of plan changes already this year that aren't even in the brochures from last fall. A lot of telemedicine benefits, all plans virtually have them now. These generally include a virtual visit with your regular doctor as opposed to a physical visit. And you have to work that out with your physician. But most of them have a telemedicine benefit where you can actually get physician advice from a doctor you don't know, but they have a set of expert docs who you can contact. And in most cases, it's free advice. So there are a lot of ways now to get medical advice while staying at home. And that turns out in many cases to benefit you and the doctor, quite apart from the COVID virus, because there are things that can be said over the phone. You're not as embarrassed. You're not going to troop down to the doctor's office 3 weeks in a row, probably, but you could call 3 weeks in a row to check how your symptoms are progressing. So there's a lot of things to check out. There will be further changes in telemedicine benefits for sure next fall. It's coming up real soon. And there will be more plans in the program, probably, some dropping out. So there's lots of things to look at, but most of them are pretty simple to check out.
This is Maggie. I just want to echo what Walton said, and we really appreciate this. First, it's great that people are here turned into this webinar. I'm guessing that means you're interested and you're engaged in your health insurance. And, you know, we always advise that eligible individuals should take a look at, should carefully consider your personal healthcare needs for the upcoming year, and think about, you know, what those may cost based on the benefits in your plan. So even though default you don't do anything if you're enrolled, you would stay enrolled in the same plan unless, as Walton mentioned, a plan had dropped out. It's still really, really important to take a look at, you know, what are the benefits for the upcoming year that mean something to you, and what is the premium cost going to be. And just one other thing that Walton didn't mention that I think is also important to think about. We have available on our website plan quality information. And plans have started submitting information about their quality on certain clinical metrics like breast care screening, but also on customer service. So how they're rated when people do surveys of the plan in terms of customer service. And those are also available in our plan comparison tool. And that's another thing that you can consider when looking at plans and making your decision for the upcoming year.
In the recent survey of federal employees who were asked which fringe benefits are most important to you, leading the pack by far was health insurance. And of what is most important about health insurance, keeping the costs down was by far most important. OPM has a fine website, and they include a lot of cost information. But there's something we include at the checkbook website that no one else has or ever has had, which is we actually calculate for you, for a family of your age and size, how much you're likely to be out of pocket in each plan in a good year, a bad year, or an average year. Add to that your premium, and we're able to show how much you're likely to be spending in total under plans A, B, C, and D. And in the DC metro area, there are about 40, and almost any large city in the country has at least 25 or 30 options. And some of them will save a typical family $2,000 or $3,000 or even $4,000. So there's big dollar savings possible. And one of the nice things, think about it as a government executive, since we're in that channel, agencies save money when enrollees make prudent choices, because the hiring agency, your employer, pays, it varies from plan to plan, but it's typically somewhere between 70 and 75% of the premium. So you're only even seeing the employee share of the premium, but there are big dollars that your agency can save if you choose a more frugal plan. And it's sad because OPM does such a good job in showing you what's available at your zip code, and you can do some of the things we could do. Also, you know, do you want to join an HMO or not join an HMO? And you can modify the list to kind of narrow your choices a bit. But people mostly don't check. They sit in the plan they're in year after year after year without ever checking to see if there's a better deal out there. One of the big additions last year that OPM allowed for the first time was for plans to pay most of the premium. I mean, and I'm not talking about retirees, not employees. If you joined a Medicare, what's called a Medicare Advantage plan, you would be able to suspend your FEHB enrollment, join the Medicare Advantage plan, not have to pay 2 premiums, but only 1. Okay, United had quite a few of these plans, several of these plans, and most of the Kaiser plans offer the same thing. So there's a lot of annuitants out there who don't even know that they could be in an FEHB plan that pays their Medicare Part B premium. For employees, how many know that there are high deductible plans? With health savings accounts, it doesn't take a lot of work to check things out. So, and again, the website information, the plan websites and the plan brochures are all easy to use and easy to consult.
Great. Walton, you had touched briefly on, the importance of telemedicine. given the extraordinary circumstances surrounding healthcare in general this year with the COVID-19 pandemic, are there any elements of plans that federal workers should give special consideration to, like telemedicine?
Absolutely. I think there's been a revolution in paying for telemedicine this year. Plans were inching towards it with OPM's encouragement. One of the nice things OPM does is encourage plans to improve their practices and improve their benefits in ways that are useful. But the virus caught us all by surprise. The big barrier to more telemedicine was the kid in the big kid in the room was Medicare, which would not pay for a virtual visit. Okay, you had to physically go to your doctor's office. Medicare changed its rule, and I don't think it's ever going to put it back. So it's now possible. I saw my primary care physician a couple of weeks ago, and the question I was asked before I went was, "Do you want to make it a physical visit or a virtual visit?" And it doesn't matter which one I chose. The point was we both had that option, and the visit was reimbursed as well, just like a regular visit. If it's a COVID-related visit, most of the plans now make them free. Okay. They also now, most of them, offer a special telemedicine benefit where the plan will hook you up with a physician who is not your regular doctor. Maybe you don't have a regular doctor. And you can get, in most cases, a free visit with a board-certified physician somewhere in the United States who will, just like everyone is watching this presentation today over the computer, you can do the same thing, only in a little better. You won't be a teeny picture or something. You'll be a big picture, and your doctor will be a big picture. So this has been a huge breakthrough. I am sure there are going to be more changes for next year, and I suspect I know OPM has got to be in the thick of it. I don't know if they're allowed to tell us yet what the changes will be before beginning of open season, but any family that's not at least considering using virtual visits, particularly in a case where you don't want to go out of the house because of the quarantine or for whatever reason, convenience, distance, whatever, it's another great thing. And you won't even find it in many cases in the plan brochure. You have to go to the plan website because the brochures were printed last winter. And some of these benefits were added this spring or summer, most of them this spring or summer.
Yeah, let me just speak to a couple things Walton mentioned. So there was actually a law passed in response to the COVID-19 epidemic, and you may have heard of these laws. There was the Families First Coronavirus Response Act and the Coronavirus Aid, Relief, and Economic Security Act. And both of those require that all health plans cover diagnostic COVID testing with no cost sharing. And that includes as Walton kind of mentioned, the visit around the testing. So if there's testing at your visit, that has to be covered with no cost sharing. So any plan you enroll in, that will be the case this year and the upcoming open season. And part of what happened in response to those acts as well were more coverage for telehealth, and we encouraged carriers in response to that to provide telehealth visits with no cost sharing as well. And I think we were fairly happy with the response from carriers, and that'll be the case as we negotiate for the upcoming benefit year, which unfortunately, because of the timing, I can't speak to right now. But that is something that's really important. And another element, I think, that kind of responds to this question is mental health coverage. I think a lot of us are facing high levels of anxiety and change that we've never faced before, and sometimes mental health coverage can help people address that. And we actually have a lot of plans that cover telehealth visits for mental health coverage, which I think it actually works together really well, right? It's a type of medicine that can be delivered in that way. So that may be something that you want to look at as you consider next year. And just another note about mental health coverage is that there's a law that ensures that all mental health coverage has to be covered at the same level as medical health coverage, and that's the Mental Health Parity Act. So plans basically can't discriminate against benefits for mental health coverage. So all plans in the program should have robust coverage. And I would say the one thing about that benefit is that just the way that the kind of medical system has evolved on that benefit is that sometimes there aren't there aren't networks available for mental health providers. So, and we've been encouraging plans to try to get them to, include more mental health providers in their network. Sometimes that's not possible. So, if you have a mental health provider, you may want to ask them, do you participate in a network with a health plan? And if you're considering it, and if your health plan doesn't participate, there are some plans that cover out-of-network benefits. So just a thing to consider.
To follow up on what Walt and Marguerite have said, the other key thing, another benefit for all agency employees and federal employees is the employee assistance program. Especially now during the pandemic, we've seen a lot of use and help not only for the employee but their families. Unfortunately, we've lost way too many folks to this COVID-19, and that's another source of things and benefits as federal employees we have. Walt hit on it early about the number of plans. You need to spend some time as federal employees taking advantage of the fact that we've got a ton of resources, opm.gov. Walt's talked about the checkbook. All these things are available, and we spend a lot of our paycheck on benefits. So take some time to invest your time on a high cost item for you and your family.
Picking up on Scott's point, which is exactly right. One of the things I like to do when I give talks about during the fall at congressional events and other places is say to people, if you pick the right health plan, it could be like giving yourself a pay raise of $2,000 or $3,000 a year. It's not a trivial decision, and it's got real financial consequences. The high deductible plans with health savings accounts, which I don't know if Scott's one of the people who writes the rules on this, but it's IRS rules that dictate the details of those plans. And they are magnificent potential savings and investment vehicles. Money goes in tax-free, it grows tax-free, comes out tax-free if used for healthcare. And there's a dozen or so high deductible plans in the federal employees system, and not enough people are joining them relative to the number who really ought to be joining to get those supercharged benefits.
I agree, Walt. The high deductible plans are probably the biggest secret in the FEHB world, because many times I personally have one, and the amount of money that the federal government chips into my health savings account is incredible, and it more than pays for any of the costs that I incur during the month. I have some family members on maintenance drugs, so it still covers that and gives me a chance to invest some money for my future medical bills. As our federal workforce has aged, the costs will just get up, and the difference between a flexible spending account and a health savings account is significant in the ability to roll it over and the tax benefits year to year and into retirement.
Now, Maggie, you've spoken a bit about some of the things that have been implemented over the course of this year with the various COVID relief bills. But I guess as OPM has prepared for this year's open season, what initiatives has it undertaken? I know, as Walt said, OPM occasionally nudges insurance carriers to provide certain benefits to federal employees.
Yeah, so we communicate our policy goals to carriers at the beginning of the year, so in the January, February timeframe. And that's in our annual call letter, and that's when we're asking them to submit their rate and benefit proposals. So that was actually a little bit before, it was published a little bit before some of this crisis happened. And then, as I mentioned, we had a follow-up letter at that point. But so the focus that we had wasn't on COVID items, but we had several items to improve quality and affordability. And we had a focus on promoting plan cost and quality transparency, on preventing surprise medical billing, controlling pharmacy costs is always a big issue for us, addressing low value care, and treating opioid addiction. And actually, opioid addiction is something that we've had a longstanding administration effort to end. And they've actually proven fairly successful. Between the president's inauguration and October 2018, high-dose opioid prescriptions fell by 16%. We're happy to see that, but we know that upcoming, that's going to still be something that we need to consider for plans.
And OPM can't really take the credit it ought to get for some of the things it does on employees' behalf. But I think the psychiatric improvements for COVID during this year of COVID, and together with the opioid and other potential treatments for drug abuse problems or alcoholism problems, are very important. While we're all stuck at home, quarantined, going a bit stir crazy, there are benefits that you can reach out as a federal employee for you or your family, or pass on the word to your friends and neighbors who you probably aren't seeing in person, but you can still talk to them, because there are just fantastic benefits that you may not even know you have.
Now, I know, as Walt mentioned, a lot of federal employees tend to stick to their plan every year. They don't necessarily go shopping. And, there are a lot of plans available in the federal health benefits program. What tools do you guys, make available to employees to sort of sort through just the long list of insurance carriers and benefits to help make the right decision for them?
Well, I'll start, but let me just say, OPM and Checkbook both provide in most respects, very similar tools, and they both, but in different ways, and you may like OPM's better than ours or vice versa, but they let you, your zip code matters, how many people are in your family, are you retired or not, are you willing to join an HMO or not? There's a series of questions you can use to filter the plans. Okay, how important is quality to you? And you can see the quality ratings for each plan based on the responses of enrollees in those plans to questions, asking them how well the plan treat you. I mean, this is not just made up stuff. It's the real deal. So the main thing we do that no one does in the same way, or really at all, is to compare total cost, including likely out-of-pocket expenses, plus premium, okay, in the good, average, and bad years that I previously mentioned. That said, the principal purpose of health insurance is, guess what? Insurance against a catastrophic wipeout. Quite apart from the fact that OPM has made sure the plans all have somewhere between very good and excellent catastrophic protection, both prominent on both our website and OPM's. And again, I'm not trying to steal. I'll turn it over to Maggie in 1 second. The catastrophic benefit in each plan is extrememely important information, and it's easy to see and easy to compare on both websites.
Yeah, thanks, Walden. And honestly, all tools you can use to make this decision, use them because it's a really important decision, as other people have mentioned. So on our website, there's a plan comparison tool, And it allows you to view the costs and benefits of up to 3 plans at a time. And it also provides quality information. And as I mentioned, including how well a plan provides or coordinates care for its enrollees on certain measures, or about what people think about their plan's customer service. And another way you can look at plans, or maybe you want to start there if you're enrolled in a plan. We have these great brochures on our website that are the full benefit information for a plan. So sometimes people, in the private sector, they don't know what their plan covers. It's not easily available. That's not true for the FEHB program. All, benefits are provided in our brochures, and hopefully they're not too intimidating. They're a little long, but if you can find the section, that applies to things you're interested in, it may not be too bad, and that's a good way to see. And it also has a page at the beginning that talks about what's changing. So you can look quickly at the what's changing page and see if it's something that matters to you or not. But I think that's a really great tool that's available to people, just the plan brochure. And also, I mentioned that we were promoting plan cost and quality transparency. So some of the plans are going to have available to you actual cost calculators on their website. And I say some because some may be available only once you're a member. So if you're shopping and you're not a member, it may be a little harder to come by. But it'll tell you like what it costs to you out of pocket for a particular drug, if you use that drug, or a particular health service if you use that service. And that's really obviously specific to you if you were enrolled in that plan. So those are good tools that I know that are available.
Let me just build on something Maggie just said. The plan brochures are awfully important, and they happen, unlike most private sector, plan descriptions, which are written in gobbledygook, insurance ease. These brochures, this is, again, to OPM's credit, are written in plain, understandable English, and the crucial thing is they're in a common format. So if you're planning to have a child next year, there's a section on maternity benefits in every brochure. And since you can easily download PDF files, you can compare 2 or 3 of them, the actual brochure language, side by side, okay, on maybe it's chiropractic you care about, maybe it's, are there any extra vision benefits? You're going to have an operation next year. What's the surgical benefit? It's very easy to understand the benefit in Plan X. It's easy to understand it in Plan Y and compare it with Plan X. And it's just, I guess we can't give credit to the U.S. government for inventing our desktop computers or home laptops, but though the federal government had something to do with both. But using your computer is just a great way to simplify and speed up the process of comparing key benefits in the plans.
Now, Scott, you had mentioned the importance of looking into your agency's employee assistance program. Can you talk a little bit more about how these agency-specific programs can complement an employee's health benefits, particularly when it comes to mental health and stress management, things like that?
Sure, Eric. One of the things, one of the little known benefits that every agency has is their employee assistance program, and they're usually contracted services with folks in many different areas to help not only employees but family members deal with stress, financial situations, death, and a lot of benefits that depending on the age. I know in our case, up to 5 free visits for a specific issue. And again, it's just one of those things that when you compare the benefits we have as federal employees to what's available out in the private sector, it's one more thing to augment. Many, as Marguerite mentioned, many of the health plans have mental health things, but it sometimes takes longer to get your issue resolved depending on the situation than you might have benefits for. So look at all those things, especially on some of those unusual things. Walt obviously has a great source to help us with health benefits, but there's the EAP can also help you on other financial decisions that you have to make that aren't necessarily tied to your health benefit or your FEHB.
By the way, we haven't mentioned, but should, there's a few other things people could do in open season, like they could set up a flexible spending account. It's open season for FedVIP, dental and vision plans, and always available, lurking around there, and is your long-term care insurance. So there are other federal employee benefits, most tied to open season, but not all. And it's just a very handy, you have that 1 month period. I guess it's November 9th to December 14th this fall. So you got a 5 week period. The election will be behind us. And well, actually, it probably won't be behind us. They'll still be counting those. I forget. I apologize. I told you a fib. But in between the suspense over counting the mail-in ballots, you do have a number of things you could take a look at, and some financially very important.
Yeah, and thanks, Walt, for mentioning that. The benefit that I think a lot of employees are not, that aware of, but that is such a great one is, the Fsafeds flexible spending account benefit. And it's pre-tax money for what you spend on, your medical costs and your dependent care costs. So for example, I have a 6-year-old and a 3-year-old, and my 3-year-old is, back in daycare here in Maryland. And so, I'm paying every week, a couple $100. And so I can actually have up to 5,000 of that pre-tax. And so it's kind of just, money in your pocket. And I think it's something that a lot of people overlook, but definitely worth taking a look.
And back, just to remind everybody again, the flexible spending account is a great way to get to, in effect, reduce the cost of whatever you're spending out of pocket by, a quarter or a third. But it's use or lose money ultimately. So you need to sort of be in the ballpark of what you're likely to be spending out of pocket. But most of us have a pretty good idea of the drugs that we routinely take. And if you're going to seeing a certain specialist, mental or physical health, you'll have a sense of how many visits you're likely to have and how much you'll pay for each. But that money is use or lose money. Ultimately, the health savings accounts, the accounts that come with the high deductible plans, that money is not use or lose. It goes into your account and it stays there, and it's your money for the rest of your life. In fact, you could change plans and you keep that account.
And just to follow up with Walt's, there's been some questions in the text chat here. The limit on the health savings account this year is $3,550 for an individual or $7,100 for a family. So that's the limit to put in for 2020. And the IRS sets those limits every year and probably update them for the future year later, probably during open season. You'll see that come out.
Just to double, because that money you put in that that health savings account is money, or a flexible spending account is money that you do not pay income or Social Security or Medicare or state income taxes on. So you are saving money right immediately before you spend a dime of it, simply because your taxable income has been reduced by that much. I see a panelist question asking about websites. Let me just mention ours. It's guide to healthplans.org. Very simple, guide to healthplans, one word, .org. And that's the checkbook website. And a lot of agencies subscribe to our guide on behalf of all their employees. And when you look at our website, you can instantly find, if your agency is one of those who give you free access. And as I say, really a majority of federal agencies do provide that. OPM's website is, well, I'll let Maggie tell you about it.
Yeah.
It's a good one too.
I know this one. We have www.opm.gov/insure. And if you go to healthcare, and you'll find easy links there. And especially once open season starts, it's readily available and obvious once you go to opm.gov/insure and click on health. Oh, and I saw one other question. It looked like a question about the HSAs and whether they're available to retirees and FSAs. And I think HSAs and FSAs are available to employees because they have to do with cafeteria plan benefits. I think there's IRS who may be able to speak to it better than me, but there is, if you do enroll in a high deductible plan, if you're a retiree, we offer HRAs that are available to retirees. So you would get, as some have mentioned, there's the premium pass-through money that goes into those accounts. So that is available to retirees through that account. But I believe the way that account works, some of the rollover isn't quite as, it's just some different provisions on whether you keep the money going forward. But it would still be available. I don't know if Scott or Walton, you had anything else to add to that.
No, you hit it on the head, Marguerite. It's just a difference because of the tax implications of being retired now versus being an active employee and putting away for retirement. So that there is the availability and some premium pass through that happens with those accounts. It's just a much smaller segment takes advantage of it because by that time you usually know, good or bad, you unfortunately are at that point where you kind of know what you like and you stick with it. But part of this whole talk is if you've spent the time to come onto the web chat, take some time and go on each of those sites and look at your health benefits and see if you can save some money for yourself or put away money for health expense that you'll have in the future.
So as we are pretty firmly in the Q&A portion of the program, I'd like to remind our viewers that they can submit any questions they have for us using the questions button on their screen. One question that I saw here is
let me try, while you're looking for it, let me just jump in on this health savings account. One point that hasn't been, I think, clearly made yet. If you have a health savings account that you used as you were an active employee, when you retire, you can't add money to it, but you carry that money with you into retirement. And I know individuals who have a health savings account with $20,000, $30,000, or $40,000 in it because they've been plunking their, for their family, two grand a year or so into it or more for 5, 10, 20, 30 years. Well, not 30. They haven't been around quite that long for federal employees, but the money can be vested and grow. So you do get to keep that account, no matter how old you are and no matter what your retirement status is, but you can only add to it while you're still an active employee. And the same thing is true for flexible spending accounts. You can only create them and use them while you're still an active employee.
Thanks, Walt. One question I'm starting to see a bit is, how can federal employees easily check to see if their preferred doctor is included in a plan? I know some of the insurers have these big, databases of doctors, but it can be difficult to filter out.
Let me jump in because we do offer on Checkbook's website, one of our features is for the DC metro area, we actually can tell you there's a few things you tell us when you log in, like your age, your zip code, family size, we don't ask for health information, but we ask for your overall health status. And one of the questions is, and are there doctors, a doctor or doctors plural, that you want to keep and want to join a plan that they're in as preferred providers? And you just have to enter 1, 2, 3, 4, 5 doctor names, and we'll tell you for all 40 plus plans in the DC metro area, which plans your doctors are in. But there's a caveat here. All we can give you at a given moment in time is which plan Dr. X is in today. And today typically is during open season. But he may not be planning, or she, to be in that plan next year. So what you really need to do, and it's the simplest thing, and you go to the web plan websites, and the problem, and they have doctor lists, but the problem, that's the same problem. That's the plan, the doctor is in the plan this year, but may not be there next year. It's simple. Call the doctor's office and ask the manager or the doctor, but usually the manager is the one to ask, hey, is Doc Sawbones going to be in my plan X next year or not? And that's the most authoritative and up-to-date information you can get.
And just to follow up on Walt, that's also one way to keep your doctor in a plan. The more people that call and say, are you going to be in this plan, the more likely that doctor is going to stay in the plan.
Great point.
I'm also seeing a lot of questions sort of touching on what federal employees should be looking at, in the open season if they are on the verge of retirement. If they're planning to retire, let's say, December 31st, 2020. Is there anything they should be looking for, that might be a little different from what they typically look for when they were working?
Well, one thing, and Maggie will tell you more about this than I will, but and it's going to be too late if you're retiring this December, but you have to have been continuously enrolled in some FEHB plan, either as the primary plan holder or as a dependent, and TRICARE will count as well, for 5 years before you retire, continuously enrolled, or it goes poof away the day after you retire. So you need to be in an FEHB plan the day you retire, and plus the preceding 5 years. But other than that, there are all the standard sort of questions. What's your health status? What's your spouse's health status? Is your doctor in the plan? How is the quality of the plan rated? These are the same questions, really, whether you're 50, 55, 65, but they get more important as you get older because typically our health problems get a lot larger as we get older. Let me stop there. I'm sure my colleagues will jump in with more that I forgot.
Yeah, I was just going to agree. If you want to keep your FEHB into retirement, you do need to meet that rule, and I'm sure that would be an important consideration for a lot of people, and you need to be enrolled on the date you retire. So as Walt mentioned, I think that's the most important thing. There may be some Medicare coordination issues, thoughts that you may want to think about if you're, close to 65 and or in the 65 range and going to be retiring, and plans should have really good information about, and I think our plan comparison tool information has this as well, as like what you would pay if you're, enrolled in Part B plus the FEHB plan, because we've really encouraged a lot of our plans to provide really, really robust benefits for those enrollees who are in Part B. As Walt mentioned, we've even had some plans that will pay part of your Part B premium. So that may be another consideration for you if you're 65 or older.
The only thing I'll add to both of those great points were it's almost even more important for the person going into retiree to look at their healthcare plans and do a financial analysis of what they need and what they can afford, because when you retire, your income level and cost and family situation significantly changes. So it's even more important to take the time, use the resources that are available to take a look and figure out what's best for you and your family.
Agreed. And I would just add that question of whether or not to join Part B at age 65, Part B being the doctor benefit, is a crucial question, because you'll have to pay, if you do sign up for Part B, you don't want to ever drop your FEHB, but now all of a sudden you're potentially and will be paying 2 premiums, unless you join one of these plans that pays most, all, or close to all of the Part B premiums. So there's a whole set of issues about whether or not to sign up for Part B. The hospital part, Part A, is yours, at no additional cost. You've been paying the taxes for Part A all your working life. But so you really need to think hard about the Medicare coordination issues. And as Maggie mentioned, there have been some big changes in those in the last few years. And so what your buddy next door used to, thought was the right answer 5 years ago may be the wrong answer today, okay, because of the changes that have been occurring over the last several years.
On that note, I'm seeing some questions as well, sort of specifically on Medicare coordination. Is there an easy way for people to sort of, line up an insurance plan and a Medicare Part B, for instance, and ensure that you're not getting duplicative services to try to, maximize your value?
On the checkbook website, that's a huge part of our website. You find out plan by plan, and you could see them side by side, either all of them at once or just 3 or 4 at once. Either way you want to compare, how much, if any, of the Part B premium does the plan pay? Assuming if you have so on, you look at the web. We rank least expensive, second least expensive, and so on. And then, of course, you need to turn to the plan brochure, and you may want to speak to some physicians, because you're into then also a set of issues about some doctors take new Medicare patients, some don't, and so on and so forth. Or you look, by the way, you could look, plan brochures have information on this exact point, and you need to check it. So I'm back on our bandwagon of look at the brochure. Most of the things in the plan that are changing are in the section Maggie mentioned called How the Plan Changes for Next Year. But the Medicare coordination benefits are in a different section. Believe it or not, section 9 of the brochure, but don't worry about that. And they can change in ways that aren't mentioned up there in the How We Change section. So unless that's changed, I don't, but the presentation up until now has been something you separately check in section 9, and you ought to do that anyway. How does this plan coordinate with Medicare if you have Medicare A only or A and B, and you've stopped working, and it's just a page or 2 of information, but it's awfully important financially.
Okay, well, unfortunately, we're not going to be able to get to all of the audience questions today, but we will be sending out all of the resources mentioned, including OPM's tools and the checkbook URL in our post-event emails. Thank you, Scott, Walt, and Maggie, for such a great conversation. At this time, I would like to turn the program over to Constance Sayers, President of Government Executive Meeting Group, for a custom session hosted by our underwriter, the Federal Long-Term Insurance Program.
Thank you, Eric. And thanks so much to our panelists. That was a really great session. It always is every year. As Eric mentioned, I'm Constance Sayers. I'm the president of Government Executive Media Group, and I'm excited to continue our conversation on demystifying federal healthcare coverage with Joan Melanson, who is the Director of Education and Outreach with FedPoint, the new trade name for long-term care partners, you may remember that, which is the new legal entity. The company administers the federal long-term care insurance program. You heard folks talk about the Fsafeds, as well as Benefits, the online enrollment site for the federal employee dental, as well as the vision program, FedVip. So, Joan, I'm just going to dive right in. A prevalent theme that we've discussed by the panel is the uncertainty during COVID. So what has this meant for the long-term care insurance benefit, particularly the federal long-term care insurance program, or the FLTCIP, as we'll call it?
Well, thank you very much, Connie. Interestingly, we have seen a renewed interest in health with COVID, and particularly with health issues. And long-term care is a part of health. Now, when you think about health as a continuum, we always think about health insurance, and the panelists talked about that. And health insurance is when you go into a hospital and the hospitals make you better. You come out and they fix you up. Now, long-term care is not that. Long-term care is when you need assistance with what we call non-medical needs. And those include things like eating, bathing, dressing, the things that we do every day when we get up. Those are not medical needs, and that's long-term care. Now, what we're seeing with COVID, though, is that care in a facility is just not ideal. I mean, many of you have been in situations where your family members or your parents have been in a facility, and guess what? With COVID, they've been isolated, they've been quarantined, and that's really not what you want to do for somebody. They really do need that interaction. So we have been seeing a renewed interest in our program, because the federal long-term care insurance program, or what we refer to as FLTCIP, has a very strong home health care benefit. And people are looking at that and saying, maybe I should consider this.
Yeah, absolutely. We've talked about this. My 91-year-old mother is in a facility, and I've had to see her through a tent. It's been great. Yeah. So you and I've worked together for about 20 years now. Your mission—
It can't be that long, Connie. It can't be possible.
It is that long,
you don't look any older than when the first day I met you.
Your mission in your job is to conduct education outreach for your programs. And so how has COVID impacted your activities and what you've been able to do?
Very interesting. Well, first of all, COVID's affected every aspect of our lives from soup to nuts. And our outreach, of course, has been impacted as well. In the fall, that's our busy season, because we've been talking about benefits. We've been talking about the open season, which is 5 weeks coming up in November to December. So our mission with OPM is to get out to the field and educate them about all of their benefits. And we've talked about the fact that you all are, of all the federal employees and retirees, as well as the military, they have access to such wonderful benefits. I work in the for FedPoint, and we have a choice of one health plan and one dental plan, one vision plan, but you all have so many choices, and that's the good news. But the bad news is that how do you decide? So what we're doing is we're partnering with all of our agencies, because they expect us to come on site. That's what we do. We go out and we talk to people. We go to health fairs. But this year, people aren't gathering. They're not going to health fairs. So we've been partnering with federal agencies, with federal executive boards, with all the different federal and military affinity groups to find out how do you get information out to your employees or your members? How do you customize their needs to getting that information out? And we've been working with them to provide that information. And so luckily, we've been in the digital arena for a long time now. And so all we had to do with COVID was just do more of what we've been doing over the years and try to find more innovative ways to make it better, because everybody's jumping into digital right now.
Well, and that we'll get to that in a second. Just a reminder, though, people can reach you at ltcfeds.com. That's ltcfeds.com, and then also 1-800-LTC-FEDS. So just in case we don't mention that.
In case I forget to mention it, right?
Or I forget to. Yeah. So what has the reaction to digital learning? Really as the only way of education. Replacing on-site meetings and events. I mean, how has that worked for you all?
Well, everybody's had to adapt, and I know everyone looks forward to our coming on site. We used to we were always doing close to 400 health fairs, and we go out to do all kinds of other on-site meetings and literacy events and so forth. So we're pivoting completely into digital, and everybody else is doing that too. The good news is that we have been finding over time that people were becoming more comfortable with digital kinds of things, and so you know, luckily we've been comfortable with it. We've worked with you for, as you pointed out nicely, it's been 20 years, and you all have pioneered the digital environment. And so it's been a really nice partnership because, you know, we could see, and starting 20 years ago, everything was really, you know, on site and talking to people. And there wasn't that much with websites and everything that we're doing now. But times have changed, and we've all been changing with them.
Yeah, I think one of the new things has been the home health care benefit with the FELTSIP. So do you know, how does that work exactly? Can you tell us a little bit more about the home health care benefit?
Yeah, you know, the home health care benefit that we have, it's been around since we started the program in 2002, but it's one of these things that, you know, people don't really look at the benefits until they need to use them. And the funny part about it is you buy this product when you're in your early 50s and you use it when you're close to 70. So it's a disconnect between getting people to be purchasing this when they're healthy and it's affordable and actually using it. But there's a lot more attention on home health care right now. What makes our product different than any other long-term care policy out there is that all of them have some component of home health care. But in addition to what we call formal home health care, and that's getting care from a licensed facility, we have what you call informal home health care. What does that mean? That means that you can have your family members and friends come in and take care of you, and they'll get paid to do that. So then you don't have to ask your sister to come and do it gratis. You can say, sis, if I got a deal for you, you can take care of me, but I can pay you for it. And then, of course, we realize at the same time that when you're asking someone to come in and take care of you, or someone who you know, agrees to do that or offers to do it, they might need some caregiver training, because you can't expect people that know what is this all about. The final thing that we offer, which is also unique to our product, is what we call a stay-at-home benefit. I mean, if I ask anybody out there, where do you want to receive care? You're going to say, I want to receive it at home. So sometimes you have to do things like adapt your home. You put in a wheelchair ramp, you put in grab rails and bars and things like that. And we do have a benefit that will help adapt the home so that you can continue living there.
And that's like really important. I think certainly even, you know, now with COVID, you know, being at home and being able to have that support is just really important. So that's a great, I'm glad that you mentioned that, because I think people may not necessarily be aware of that. Open season is around the corner. If health fairs at agencies are not being held, what are employees supposed to do to find out, you know, how to choose, make all these choices and things? What do you recommend?
It's all digital these days. And it's very interesting because, you know, it seems like we just finished one open season and the next one is upon us. And when I say November right now to you, you say, oh, that's way in the future. But guess what? Today or yesterday was the first day of fall. And who would have thought we'd be here right now? Turn around, it's going to be open season. And before we know it, it's upon us. Now, luckily, we have developed a number of ways that people can get the information. It's to dovetail on what we heard from Walt and Maggie from OPM and others, that there are things that you all can do fortuitously. You're not just stranded because people can't go. You can't have all the vendors coming into the agencies. So we offer a virtual benefits fair, and I'll talk a little bit more about that in a minute. We have a very comprehensive website, which is ltcfeds.com. And on that, we also have something that's very new. It's called a guided planner. And this is for long-term care. It's to help you figure out, do I really need this thing? And if I do, how do I design it to meet my particular needs? Because there are a lot of considerations that come in when you choose it. It's your budget, it's your family situation, where you're going to retire and so forth. So this will help you do all of that. So we have a whole bunch of tools on our website, which is LTC Feds. We also, as you mentioned before, we do have a place you can call, which is 1-800-LTC-FEDS, because not everybody wants to do everything digitally.
Right.
Or what we find is that people will start researching it and they'll get into a situation and say, I just like to talk to somebody about this.
Right.
You can call the phone people, they don't work on commission, and they'll answer any question. They'll spend as much time as you want on the phone, and they're just great to help out. And because our mission, as I said before, per OPM and our contract with them, is to provide the right amount of information and education to help people make an informed decision. That's very important.
That's great. Now, you mentioned the virtual benefits fair. So what is it and how do I use it?
Okay, it's been my little baby for a while. We call it the VBF. A virtual benefits fair is just like going to a home health care, let me step back, like going to an agency, a health fair. That's the word I'm looking for. A health fair on site. Except that instead of going down to the room and walking around from table to table, and some of the vendors aren't there, and you're trying to figure out what you're doing, you can do this within the comfort of your home. So imagine this: you log on to LTC Feds, and you come into the screen, and in this part of the screen, you see all of the health insurance carriers listed, all the major ones. Then you go into this area and it's all dental carriers and vision carriers. And there have been some changes in dental and vision plans this year through Benefits. And Benefits is the online enrollment website that we administer. And then you see Fsafeds. We talked about that earlier. A lot of people would put money in their FSAs if they felt a little bit more comfortable. So FSA is there. Benefits and FELTSIP, the Federal Long-Term Care Insurance Program. So you can imagine everything is right there. You click on the booth that you're interested in, and you'll see all the different carriers from which you can choose. Go into the carriers that you want, and you can see all of the program brochures, videos, webinars, and we have 4 days, that's 4 days throughout open season, where you can chat. So if you're interested in something that a carrier had, you just send a note and say, I'm interested in whatever, and you can chat with them. So what we're doing is we're aggregating all of this information into one place so that it's very easy for you from the comfort of your home to have access to all the information. And, you know, right now, first of all, we have over 50% more registrants than we had last year at this time. People are doing it. And I hear Walt Francis every year talk about, you know, people could save money if they took a little bit of time to look at this. And guess what? What do we have now? We have time. And so take time and you may save some money because, you know, if it's working for you, and I'm as guilty as anybody with this, you know, something's working and you say, I'll just roll it over. I don't have to do anything. But, you know, next thing you know, you realize your kids are suddenly older. They don't need, they have the same dental or vision needs. I mean, things change. Right. And guess what? The plans change, the benefits change, the rates change. You might want to, you know, it might behoove you to look at that. Take a little time to invest in your future because, and that was the message we heard from the panel the whole time. It doesn't hurt to shop.
Yeah, no,
and take a look at it. So I would say that, you know, take time to look at that and evaluate what's out there with your needs and make the best decision that you can.
That's great, Joan. So where do we go from here? So how do people get a hold of you and tell us a little bit more about you know, what they can do for next steps?
Well, I guess what I would say is, first of all, stay safe and healthy. I mean, that's really, here we're sitting wondering what's going to happen with, you know, flu season coming and everything else. So we're all wondering what the future was going to hold. So while you're doing that and while you're quarantining or at least curtailing a lot of your activities, I would say use all these digital resources at hand. You do have time and take a peek at what's there. I would register. You can do it right now for the virtual benefits fair at LTC Feds. You don't have to wait until open season starts. But once you register, you'll get reminder emails. And then when open season opens, and that's November 9th through December 14th, you've got 5 weeks, you can go in and out and look at any of those resources online. They're all in one place. I think it's really nifty. So I would say look at that. I would say when you're in there, you might want to look at your long-term care needs. And we were talking, and everybody's always interested in retirement, but when you look at all your benefits, long-term care insurance is one of those things that I view it as the insurance on the nest egg that you've built when you go into retirement, because it could be the one thing that could erode that nest egg that you have saved.
Really good point.
So I would say take a peek at that, because again, our mission with OPM is to provide all the information, and we do it in so many different ways through our LTC Feds website on long-term care and the FELSIF, and we have the virtual benefits fair to make it easy for everybody to try to make an informed decision. So besides taking some of the time to do that, and I understand the movies aren't that good anymore, and they must not be that good, because I'm looking at the attendance on our webinars and the virtual benefits fair, and I'm saying, oh my goodness, and we're not even offering virtual popcorn. I'm wondering how it could be that people are so interested. But, I think with the attention of, with COVID, people are looking at health, they're looking at their families, and they're saying, it's time to, we have time to make an assessment of where we are. And people are looking differently. They're not so busy running around and doing all the activities we did before.
Well, certainly, I think this has also brought health to the forefront. I mean, we're
Absolutely.
all because of a health issue. So, Joan, thank you so much, as always, for speaking with me today and sharing your insights with our audience. It's always extremely valuable conversation on federal health care. Unfortunately, that is all the time we have for this session. Today's event would not be possible without the support of FedPoint. This event has been recorded, and it will be available to view on demand and to share with your colleagues. And please share it with your colleagues. So thank you, Joan, and thank you for everyone for joining us today. Have a great day.